Welcome to the 2024 Open Enrollment Meeting. My name is Rebecca Hawes. I'm with Gallagher Benefit Services, and I'm here to talk to you about the benefits effective April 1st, 2024. We're going to talk about the benefit highlights and cost, our benefit resources, and then our reminders and deadlines. As a reminder, this is your annual open enrollment period. During annual open enrollment, this is your opportunity to make any changes. You can add or drop dependents. Maybe you want to add the dental plan because you waived it last year. These are all examples of what you can do during open enrollment. All benefit changes will be for an effective date of April 1st, 2024. And then as a reminder, open enrollment is that one time of year that you can make a change without a qualifying event. Of course, if you have one of those qualifying events, marriage, divorce, birth of a child, that does allow you to make a change with it during the year, but you do need to notify your HR team within 31 days of that qualifying event date. For example, I get married on June 1st. I want to add my new spouse. I need to let HR know within 31 days of June 1st. If I forget, something happens, and I don't let them know until September 1st, my 31-day window has expired, and I will have to wait until the following open enrollment to make any changes to my benefits. Annual open enrollment's kicking off today, March 18th, and it's going to go through March 25th. Good news is we're staying with United Healthcare this year. There's no changes to the benefits, so our benefits are staying exactly the same for the medical, dental, and vision, as well as the life and disability plans. Next on the screen is your medical plan from United Healthcare. Again, there's no benefit changes. It is staying the same. If you haven't registered and logged in through myuhc.com, I encourage you to do so. Wealth of information out there available to you. As a reminder, that preventative care is covered at 100% as long as you use an in-network provider. So we're going to go through the PPO plan, and I'm going to focus on the in-network benefits because I always encourage you to stay in-network if possible. By staying in-network, it will save you significant dollars. You have that annual deductible of $2,000 per individual, $4,000 per family. Then you have your annual out-of-pocket maximum. As a reminder, our deductibles are based on a calendar year, so they are based on January 1st through December 31st. Once I reach my annual out-of-pocket maximum, again based on a calendar year, in network, the plan picks up at 100% for the remainder of the calendar year. The coinsurance benefit is 100%, meaning after I meet that deductible and I go in for services that have a coinsurance responsibility, such as hospitalization, United Healthcare picks it up at 100%. We can see that in the next line item, hospital services, inpatient. If I'm inpatient at the hospital, I'll have to meet my $2,000 deductible. But then if I'm going to an in-network provider and facility, it's picked up at 100%. There is the emergency room treatment. Does not matter if I'm going in or out of network, that's covered with a $300 copay. Always encourage you to use urgent care if it's not a life or limb threatening event. With urgent care, it's a $75 copay. I do want to take a pause, and I do want to talk about emergency room and freestanding emergency rooms that are popping up all over the United States. These emergency room freestanding look like an urgent care facility. They're not tied to a hospital, but they are treated just as an emergency room with a hospital, and it can cost you significant dollars. Actually going to a freestanding emergency room is more expensive than going to an emergency room tied with a hospital. So I just want to let you know of those circumstances because we're having a lot of questions about that. Back to the chart, we'll see physician visits. Again, we're focusing on in-network. It's a $30 copay to see my primary care physician. As a reminder, that's going to be your general medicine, internal medicine, pediatrics. Those are all considered primary care physician. If I have a child covered under this plan and they are under the age of 19, they are going to be picked up at 100% for those primary care physicians, regardless if it's preventative care or not. So I have a 17-year-old teenager. She goes into the primary care physician because she has a sinus infection. I do not have to pay a copay. It's picked up at 100%. Specialist network, if we're using that UHC designated network, it is a $30 copay. If we're using any other UHC specialist, it is a $60 copay. As a reminder, a specialist is going to be someone like a cardiologist or an allergist. Virtual visits are picked up at 100%. We have another slide. We'll talk about virtual visits in a few minutes. And then preventative care. We always encourage you to go have your preventative care done. That includes those annual adult physicals, well woman exams, well baby child checkups. That includes vaccines, COVID, flu, whatever the vaccine is. Shingles is another one that's going on right now. So encourage you to get those preventative items done. Again, picked up at 100% as long as you're using an in-network provider and facility. And then we have a couple of other line items here, office and outpatient surgery. Those are items that would be picked up after your deductible. So if I'm having an outpatient surgery, my $2,000 deductible is going to apply first, and then it's going to be picked up at 100%. If I'm going in for diagnostic lab and x-ray on an outpatient basis, that's actually picked up at 100%. There's no copay or deductible that applies. And then those major diagnostic items, things as a CT or PET scan, MRI, those are picked up at 100% after that $2,000 deductible. Prescription drugs. Your prescription drug copays are not changing. If there's been any change to your specific medication, then you would have received a notice from UHC in the mail. That notice could have stated that your drug is going to be moving up to a higher tier, or in some cases, we've seen some of the UHC drugs moving down to a lower tier. As a reminder, that tier 1 is going to be mainly our generic medications. Tier 2 is going to be some of the high dollar generics and then those preferred brand name. Tier 3 is going to be what we call preferred brand name medications. And then those specialty medications are going to fall under the specialty medication copays that are listed. Those are typically going to be medications that we see on TV at night. They're going to be high dollar drugs. Things such as Hep C or cancer drugs typically fall under that specialty medication. UHC has some great tools. We just want to remind you of those tools in case you're new to the program or in case you haven't used the services and this is your first time to really interact with the medical plan. The UHC app is terrific. It can cover so much information in that app. One of my favorite things, though, is that I can download my United Healthcare ID card through the app. So I'm at the doctor's office, I'm in the emergency room, whatever the case might be. I have my ID card with me at all times if I've downloaded that UHC app. So again, encouraging you to activate that myuhc.com. We know there's some employees that haven't done that yet. Not a problem. We can still get in there and activate it. You can find in-network providers, that in-network urgent care facility. They can even estimate your cost. Maybe you know that you're having an upcoming procedure done. I have an upcoming procedure done and coming up in April. I'm going to have a colonoscopy. It's not preventative, unfortunately, because I've had a history. So I can go in there, though, and estimate what my cost is going to be in April for that procedure. Virtual visits. Hopefully everyone has access to virtual visits. We live in after COVID, we do a lot of things virtually where we before did in person. Virtual visits is a great way to be able to receive care. It's not going to cover everything, but it is going to cover some of those common conditions, sinus infection, uh, pink eye, things such as a rash. You can talk to a doctor with your smartphone or your computer, have a face-to-face time with them. Typically, it takes less than 20 minutes. If there is the need for a prescription, that doctor who you're seeing during that virtual visit can even prescribe you medication. So it is terrific. These are the medical payroll deductions. You work for a fabulous company that picks up a large portion of not only your cost as employee only, but also if you're covering dependents. There has been an increase this year. Your employer is absorbing the majority of that increase that we're having. Our increase is due to inflation. Unfortunately, I hate even saying that. Um, but we all know that when we go to the grocery store now, our groceries are costing more. When we go out to eat, those costs have increased as well. And unfortunately, United Healthcare is issuing a standard inflation increase on almost all of their groups this year. The dental plan, no changes to the dental plan. Everything's staying exactly the same. As a reminder, your deductible runs from January 1st to December 31st, as well as your annual maximum. Again, you have a great plan that picks up those preventative services at 100%. No deductible applies. Once you go in for basic services, that $50 deductible will apply. UHC picks 80% of the charges up. You pay 20%. Major services, things like crowns and bridges and dentures, that's picked up at 50% after that $50 deductible. You'll see that annual maximum of $2,000. So each person who is covered has a $2,000 annual maximum. And then you also have the orthodontia benefit for those children under the age of 19. If you have a kid or children that need braces, this is a great benefit. They get a 50% benefit of those covered orthodontia services up to a $2,000 lifetime orthodontia maximum. These are your dental payroll deductions. Again, your company's picking up a large portion of this premium. The vision plan, no changes to the vision plan. We still have a great vision plan. Again, I'm going to focus on in-network benefits here. I can get an eye exam for $10. I can have frames and lenses. I have up to a $100 allowance on my frames. After that, I get 30% discount. If I want to get contacts, I can get that in lieu of my glasses, and I have up to a $105 allowance. I do want to point out the frequency on the vision plan. If you haven't utilized the vision plan, encourage you to do so. You're paying that premium. You can have that eye exam once every 12 months. After that 12-month period expires, and you get your next eye exam. But it's not based on a calendar year or a plan year for our frequency. Instead, it's based on a date of service. So if I go in today, March 18th, for my eye exam, I have to wait 12 months from this date to get my next eye exam. Here are your payroll deductions for the vision plan. Again, this is a 100% voluntary plan. You have a basic term life and AD&D policy that is picked up 100% by your employer. They are providing you a life benefit of 1 times your annual earnings up to $500,000. The one thing I always like to remind people about during open enrollment is to check your beneficiary information. Our plan, our lives change, right? Maybe it's a new spouse, maybe it's a new girlfriend, boyfriend, whatever the case is, just encourage you to check your beneficiary information. You have the opportunity to purchase voluntary life AD&D for yourself. So Perhaps you need additional life insurance. The latest statistics out there is that we need 10 times our annual salary in life insurance. So maybe you need some additional life insurance. This is a great opportunity for you to pick up some life insurance for yourself. These are group rates. If you already have the life insurance today, there's no changes to that. You'll just want to make sure that you continue to renew that through open enrollment when you go through that open enrollment window with ADP. Short-term disability. This is a voluntary benefit on the short-term disability, meaning that you pay for this out of your pocket with after-tax dollars. But the great thing about that is that your benefit is tax-free if you ever do receive a benefit. With the short-term disability, I like to think of it as income replacement. If I become sick due to an accident or illness and I can't come to work, this is what's going to help me during that time and replace my income until I can get back to work. It's a weekly benefit of 60% of your weekly income up to $2,000. You do have an elimination period of 15 days. I'm sorry, of 14 days. Your benefit starts on that 15th day. You can potentially receive this benefit up to 26 weeks. There is a pre-X limitation on it, meaning that they're going to look back 3 months prior to being effective. If you've been treated for or diagnosed for any condition during those 3 months, it will not be covered for the first 12 months. For short-term disability purposes, pregnancy is considered a pre-X. This is open enrollment. You can join now without any medical questions, so it's a great benefit to elect. Long-term disability, this benefit's covered at 100% by your employer. With long-term disability, again, it's income replacement. Something happens to myself and I can't come to work. I get in a car accident and I'm out of work for a year. How am I going to put food on the table? How am I going to pay the bills? Long-term disability helps us during that time. Again, a 60% benefit, now based on a monthly benefit up to $10,000. Your elimination period is 180 days. If you have the short-term disability, you're satisfying that elimination period during that time. Your maximum benefit duration for this is Social Security normal retirement age. Depending how old we are, what our date of birth is, it depends if our retirement age is 65, 67, or longer. Employee Assistance Program, also referred to as an EAP. An Employee Assistance Program is a great program that provides us with things such as balancing work and life. Maybe we have a stressful situation at home with a rowdy teenager. Maybe we have lost a loved one. Um, Maybe we need help with elder care. Our workforce is getting older. We have older parents out there that we're needing to help. These are all examples of what an EAP can help us with. Guidanceresources.com is the website. We've provided the phone number as well as the web ID. Accident. Accident coverage is different than health insurance. So I would just want to take a pause here. Accident coverage is what we call a cash or supplemental plan. With accident coverage, it does not replace medical insurance at all. This is just a supplemental off the job that can assist you with out-of-pocket costs by providing benefits that pay directly to you. With the accident, we've listed the rates on the screen. If you're wanting to enroll in this for the first time, you'll want to reach out to your HR email address that we've listed on the screen as well. I have this policy. Again, I've got that 17-year-old teenager. I love her, but she's a little accident prone. So we typically have some sort of sporting event that she has an accident with. She got a concussion with basketball. So we took her to the urgent care. We had some scans done. We had a doctor visit, and we got paid about $250 from our accident plan that we have. So that's just an example of an accident that you can use this for. Critical illness, again, this is another supplemental plan. It's going to provide you a lump sum benefit to you. With the critical illness, you can select either a $10,000 lump sum benefit or a $20,000 lump sum benefit. Critical illness is going to cover things such as cancer, heart attack, stroke, if you have a major organ transplant, end-stage renal failure. These are all examples of the illnesses that it would cover. You do have to be insured and effective on the policy with one of these covered illnesses in order for it to give you a benefit or payment amount. So if it's going into effect April 1st for me for the first time, July 1st, I have a heart attack and I picked that $20,000 benefit, then Allstate's going to send me back a $20,000 payment. It's going to be a check or direct deposit. I can use that however I wish. For me, I'm probably going to use it to offset my medical cost. I'm going to use it to live off of because I'm probably not going to be working immediately again because of the heart attack. But again, that $20,000 is strictly however you would like to use it. So benefit enrollment and deadlines and things to remember. We're going to be doing online enrollment again. It's going to happen March 18th through March 25th. Your benefit elections will be effective for the new plan year, April 1st, 2024 through March 31st, 2025. That is a typo right there. So we need to make sure that we understand what we're electing for is going to be for the next 12 months going forward. This is going to be a passive enrollment. So if you're happy with what your benefits are listed today, those are going to roll over to next year, effective April 1st. If you want to make any changes, you do need to get into the system and make those changes.